All right, welcome to our Nutrition Talks webinar. My name is Tavis Piatoli. I'm the healthcare account educator and dietitian with Omega-3. I oversee our sales program. We'll get started with Kelly Patterson in just a second. We'll be talking today about omega-3 supplements one-on-one, really diving into the different forms of omega-3, and Kelly will kind of walk and answer all the questions at the end. Also, coming up in April, our next webinar will be with our founder, Dr. Bill Harris. That's going to be on Tuesday, April the 16th at 12 Central. We're going to be diving into all the most recent omega-3 research. What is some of the new omega-3 research around omega-3 testing and index, and what does that research say? So we'll be get starting in just a few more seconds. We're going to give people a little bit more time to get into the room. We know a lot of people are taking their lunch breaks depending on what part of the country they are in, if they're in the Eastern, Central, or Mountain, or even Pacific time zone. And again, remember, if you cannot attend live for future webinars, be sure to register. We will get you a copy of that replay. While we're waiting, I'm going to give you a little bit of an overview about Kelly and her background. Kelly is a registered dietitian and certified specialist in sports dietetics. She's based in Raleigh, North Carolina, and specializes in biomarkers for human performance and longevity. After spending most of her career working for the U.S. military, including 5 years as a tactical performance dietitian for Army Special Operations, she is the clinical nutrition educator for Omega-3 Analytics. She completed her bachelor's degree and dietetic internship at SUNY Buffalo State College in Buffalo, New York, and her master's degree in human performance and sports nutrition at Logan University in Chesterfield, Missouri. Kelly, I am going to turn it over to you and let you begin the webinar.
All right, are we all set to go?
Looks good.
All right, great. All right, well, thank you so much, Tavis, for that introduction, and welcome everybody. As Tavis said, our topic today is going to be omega-3 supplements, and we're going to cover just kind of as much as we can. This is a really big topic area. There's so much to learn about supplements and their use cases and all of that. So we'll go ahead and dive right in. Just a quick conflict of interest. I am a contractor with Omega-3, and we do own a supplement brand, Parasol Nutrition. All right, just a quick outline and overview of what we're going to talk about. We're going to kind of do a review of overview of omega-3 supplements. Then we're going to talk a little bit about kind of the wide world of supplement regulation and supplements generally. Talk a little more about different omega-3 options, dosing, and then getting the most out of your supplement if you or a patient, or you work with patients that you'll be recommending supplements to. Learning objectives for today. Today is eligible for a CU credit, and it is understanding our two learning objectives today are understanding the differences between the different types of omega-3 supplements, and then understanding how to optimize your omega-3 supplements. All right. All right, so just to get started, we're going to start at a really high level here and talk about just the wide world of supplements. Just a few statistics from the FDA. There are over 100,000 dietary supplements on the market. That's not just fish oil, obviously, or omega-3s, but all dietary supplements out there. There's over 100,000. And within that 100,000 plus different supplements, there are many, many different, thousands and thousands of different active ingredients, and non-active ingredients, forms, different types. So it's a really, really, really large market. Just to give some context to that number, is that a lot or is it not a lot? There are only 19,000 FDA-approved prescription drugs on the market. So just in comparison, if we're comparing prescription drugs to dietary supplements, there are far, far, far more dietary supplements than there are prescription drugs. And there are 300,000 FDA-approved over-the-counter drugs. So that's a different category. And that category only includes 800 different active ingredients. So that includes like acne medication, allergy medications, all sorts of stuff that are over the counter that are FDA regulated. The dietary supplement category on its own is over 100,000 different products. So it's a massive category. And it's something that a lot of people have a little bit of difficulty navigating because it is so confusing, and it is regulated very differently than obviously prescription drugs and over-the-counter medications. When we kind of come down a level and look at fish oil or omega-3 supplements as they are, it's even difficult to kind of group that as one group because there are products that contain multiple different active ingredients that might have, let's say, vitamins in them and omega-3s. There's drinks that can or that include omega-3s. There are all sorts of different products, but there are thousands and thousands of different fish oil products. It's hard to come up with an exact number. I did a little bit of research trying to find out how many products containing either omega-3s or fish oil are on the market, and I couldn't really get an answer on that. But I can tell you, when you go to Amazon and just type in fish oil, you get over 4,000 results just for that. If you type in omega-3s, it's even more. And that's just the upper limit that Amazon will tell you it counts to. So to suffice to say, there's a lot of area to be confused when it comes to supplements and talking about supplement safety and talking about kind of selecting a good supplement. There are a lot of high quality brand fish oils, omega-3 products, and they can be difficult to find. But I will say that I am not going to be recommending any specific brands within this webinar today. We have a lot of wonderful brand partners, and but I want to give practitioners and consumers the tools to navigate their choices on their supplements themselves. And I also want to give people the tools on how to optimize the supplements that they already are taking. And there are many use cases for omega-3 supplements and omega-3 products. If you've watched any of our webinars, you see that we are big proponents of consuming as many omega-3s as you kind of can. And there are many different reasons to do that, many different conditions, many different risk assessments that may be beneficial for taking an omega-3 supplement. The focus of the presentation today will be on the products, method, and methods that impact the omega-3 index itself, the test. As if you've attended any of our other webinars and watch any of our other content, you'll see that the omega-3 index itself, it's just a blood measure. And actually, I'll go ahead and talk about that real quick. So what is the omega-3 index? The omega-3 index is a measure of the amount of EPA and DHA in the red blood cell membranes. The reason I'm kind of relating everything back to that is obviously it's the test we offer, but in a lot of the research discussing different disease states, different conditions, reduction of risk of different conditions, the omega-3 index is used as the biomarker, as sort of a marker, a measure of a goal to get for omega-3 intakes. So it's sort of the benchmark of what we're looking at. And so the goal range of the omega-3 index is between 8 and 12%. So when I'm talking about, supplements being effective or getting to levels that we want to get to, that's what I'm referring to, is a goal range omega-3 index between 8 and 12%. Okay. Again, there are many, many use cases for omega-3 supplements, but this is kind of where we're going to focus on, is that blood level, because it does relate to so many of those conditions. All right, so taking a step to the side here, we're going to talk a little bit about supplement regulation, or kind of lack thereof. There is a big kind of misconception that supplements are not regulated in any way whatsoever. And while functionally that kind of feels true, and sort of on the ground it feels like that's how it is, kind of contrary to popular belief, the FDA does have some role in supplement regulation, but it's very different from the role in conventional food and drug regulation. So it's very different. If we kind of choose two products off the shelf, it's very different from a prescription drug regulation, and it's very different from over-the-counter drug regulation. So for instance, like a Tylenol or ibuprofen, those types of things, their dietary supplements are in their own separate category. And you can read through all of this if you want, but the big line items here are that the FDA does not have the authority to approve dietary supplements for safety and effectiveness, or to approve their labeling before supplements are sold to the public. This is a very big difference from, let's say, prescription drug or over-the-counter drug, whereas those products have to present research and clinical trials to prove that those products are safe and effective for the things that they're claiming prior to entry on the market. Supplements don't have to do that. And then under in the FDA, the responsibility of dietary supplement companies is or the responsibility is on dietary supplement companies to ensure that their products meet safety standards for supplements and are not in violation of the law. So it is a little bit of a sort of companies regulating themselves, and there isn't an exterior kind of third party regulator that is making sure things are safe and effective. And so we know that, omega-3s and fish oil are pretty safe and are effective for many different things. So this isn't to say that fish oil is not safe, not effective, but there is a lot of wiggle room when it comes to quality of products, dosing of products. It's very, very different than, let's say, when you're pulling an omega-3 supplement off the shelf, if you just walk into your kind of local drugstore versus grabbing a bottle of Tylenol. Dosing is not standardized. Ingredients are not standardized. Form is not standardized. They don't have to prove efficacy, things like that, before putting products on the market. So it's just something that, we have to consider. A few more kind of notes on supplement manufacturing. All supplement manufacturers are required to follow what are called GMPs, which are good manufacturing practices. This is an FDA standard for basically all food and drug manufacturing in the United States, but enforcement, especially in the supplement space, is pretty weak. And there are a lot of companies that will kind of slap these GMP certified labels on their products to kind of make it look like, oh, this is an FDA approved type of thing. For a lot of folks who don't necessarily understand the difference, these labels they don't mean anything. All manufacturers of any food product or supplement product are required to follow GMP practices. Doesn't mean they always do, but they're supposed to. So these labels, these GMP certified good manufacturing practice, these are rather meaningless. It doesn't mean that a product that has this is bad by any stretch of the imagination. It just isn't necessarily meaningful that it has been looked at for safety and efficacy by any third-party group. There are some third-party agencies that do test supplements that can certify them for ingredient verification and dosing accuracy. So one issue that can be the case with some supplements of lower quality is they don't have enough of the active ingredient that they have that they claim on their label, and I'll talk about labels in a few minutes. There are ways that they can sort of hide the levels in kind of labeling, sneaky ways of labeling. These four organizations are kind of the big four when it comes to third-party testing for supplements. So there's USP, NSF, Informed Choice for Sport, and then BSCG. These are all three different agencies. They all have different standards, so they don't all test for exactly the same things. They all have different levels of testing within their standards. So NSF, certified for sport, means one thing. There's Informed Choice, and then there's Informed Choice for Sport. There's very, very different levels within each company of what type of testing they're doing. But as a general rule, if you're really confused on kind of where to start, where to look for, if you start looking for supplements that have one of these third-party testing monikers or are third-party tested by one of these groups, and these will be on the label. You can also go to their websites and look for products. That's a good place to start. Although, again, it doesn't mean that a company that doesn't have one of these is necessarily a bad product. It just can be helpful for people who are looking for somewhere to start and aren't quite sure what where they want to start looking for a good quality product. Okay, so on from regulation, moving more into supplement facts labels. So if you get any item of food, you're going to have a nutrition facts label. And with supplements, we have supplement facts label. And kind of the anatomy of a supplement facts label, they actually look a little bit different depending on the product. But this is just an example of a omega-3 product. Full disclosure, this one is actually our Parasol Nutrition product. So this is a pretty good high quality supplement. But just to start at the top here, big things to point out that are kind of, they're similar to a nutrition facts label with very distinct differences. So at the top here, the serving size here is 2 soft gels. This is really, really, really important when it comes to especially fish oil products, because oftentimes you'll see a product that has a serving size of 2 soft gels or 4 soft gels, and people are only taking 1 because that's what they assume they need to be taking. Or in the case of liquid products, the serving size might be 1 teaspoon and people are just taking, a capsule full, or they're taking a sip. I've kind of heard it all and how people will do the dosing. So it's really important to pay attention to the serving size when it comes, especially with fish oil or any omega-3 supplement, because you need to know how much these ingredients are, how many pills, how many capsules, or how many teaspoons you need in order to get these numbers. And more often than not, I see people taking too little. They're taking 1 soft gel when the serving size is 2. So they think they're getting 1,500 milligrams of omega-3s, and in reality, they're only getting 750 milligrams. They're not getting enough. So really pay attention to that serving size. And all values listed on these labels are per the serving size, not per capsule. That's very important. Moving down here, calories, things like that. There will be some calories in all omega-3 supplements, fish oil supplements, and that's simply because you are consuming fat. It's a small amount of fat, but there will be calories. So that's sometimes surprising to people. It's pretty insignificant in the overall scheme of things. Here are the big important ones for omega-3 supplements. The top line here where you see total omega-3s, that is the most important number when it comes to an omega-3 supplement, is the total omega-3s. What you can see oftentimes will be on the front of a bottle, you'll see 1,000 milligrams of fish oil. And you turn it over and look at the supplement facts label, and it'll say total omega-3, 400 milligrams. What that means is that you're getting 1,000 milligrams of oil, but only 400 milligrams of that is actually omega-3s. And it's typically some kind of filler oil, carrier oil that you're going to see in those products. And that's really, it's a little bit of an advertising gimmick, and it saves money, but that has a lower omega-3 dose. The breaking out here of the EPA and DHA doses. So as you can see in this one, this is EPA is 800 milligrams, DHA is 600 milligrams. Adding those two numbers together will tell you exactly how much you're getting of those two. So in this case, it's 1,400 milligrams omega-3s for those two, and then other omega-3 fatty acids, 100 milligrams. Those aren't specified, and usually you don't want to count those towards your omega-3 dose, simply because it may be another omega-3 like an ALA that we don't necessarily, it doesn't impact the omega-3 index too much. So in this case, you would consider your dose as about 1,400 milligrams. That combo EPA and DHA is really what we want to talk about when we're talking about impacting our omega-3 index, because again, that is the combination of EPA and DHA in our red blood cell membrane. So this can be a little bit confusing again, because the front of the bottle can say something different than the supplement facts label. The supplement facts label has a bunch of different numbers on it. And if you're not sure what you should be caring about, if you're really confused, you want to look for the EPA number, the DHA number, and add those two. And that's your dose that you're getting of the omega-3s that will impact your omega-3 index. And that's for any product, whether it's liquid, and we'll go over those forms in a little bit. So this is another product, a different one, that just to point out a few key differences, just to show where some of this stuff can get a little more confusing. So this is a different product, and is why you have to really look per individual item. This is a product where the serving size is 1 soft gel. So this dose could be doubled in order to get the higher dose if you're comparing it to another product where the serving size is 2 soft gels. It's just really important to know what that serving size is. This one here is exactly the example of what I was showing before, whereas omega-3 concentrate from fish oil is 1,200 milligrams. And then on the front of this particular product, it's 1,200 milligrams is advertised as 1,200 milligrams of fish oil. But when we go to add up the EPA and DHA numbers, 360 plus 300 is actually only 660 milligrams. So on the front of this bottle, you're seeing, okay, at 1,200 milligram, I'm taking 1,200 milligrams of fish oil. In reality, you're only getting about 660 milligrams of omega-3s that will count towards improving those omega-3 indexes. This is probably one of the biggest areas where people get tripped up when it comes to, why is my omega-3 index not improving? I'm taking a supplement, but it doesn't seem to be working. What's going on? This right here is what gets people. They're not seeing the actual amount of EPA and DHA that they're taking. They're getting, fooled by that kind of misleading number on the front of the bottle. In this case, it would be easily rectified by either you could switch your product, or you could just take two. You can just take two soft gels, and then you'll be getting, closer to that 1,300 milligrams a day if that's the dose you wanted to get. The downside of that is obviously you're going to go through your product twice as fast. And so you'll need to buy another bottle. So people think they're saving money by getting something cheaper. And it's not to say that if it's expensive, it's better. But oftentimes people will take something cheaper and say, oh, well, if I'll just take this one. But if they have to double it and buy it more often, it may not actually be any cheaper than taking something that's a bit higher quality. And this is the last part on supplement facts labels. This is one that really kind of gets to me because I think it's just a very easy way to fool people. Supplement companies are allowed to put these quote unquote proprietary blends in, which helps them hide the actual amount of product and active ingredients in them. So for instance, this product, they put a proprietary blend of 1,200 milligrams, and included in that is some fish oil. But what's the kind of trick here is that they are not required to list out the exact amounts of each of those items in there. So they don't have to list out the fish oil, the vitamin D, and the flaxseed oil dosing at all. So this could have 100 milligrams of fish oil in it, or it could have 1,000 milligrams of fish oil in it. It could have, and it doesn't say omega-3s listed on it at all. It doesn't list out the EPA and DHA. It's because they can hide all of that under this proprietary blend label. As a general rule, I would highly recommend people kind of stay away from the proprietary blend products, because you just don't know what you're getting, and they don't have to disclose that on a label. It's not to say they're all bad. It's just something that you're not sure. And when we're trying to raise your omega-3 index levels, if you don't know what you're getting, you're really just kind of taking shots in the dark and hoping you're getting enough. And the most likely answer is that there's just very, very little fish oil and very, very little omega-3s in this product. It's just the most likely scenario, although we don't know because they don't have to list it. So that's one to be really, really, really mindful of, is this proprietary blend trap. All right, so that was a little bit about supplements overall. And now we're going to go into kind of differences between products. So if you're looking for a product at this point, you understand, maybe I should look for something third-party verified, check those dosing, look at those supplement facts labels and see how much am I actually getting. And now we're going to talk a little bit about some other differences. The big differences you see between products, obviously those safety measures we talked about, brand, different manufacturers, and then we're going to talk about dose, chemical form, and physical form. So pill versus liquid. A form of fish oil, when someone says, well, what form of fish oil you're taking, they can mean many different things. In kind of most folks' mind, they're going to be thinking about chemical form, but we can also talk about kind of the source of the fish oil, what animal or plant is it coming from, and the different types of oils. But it also can mean method of delivery, right? What form of your fish oil are you taking? Is it a pill? Is it a liquid? So when someone asks what form you're taking, most people are referring to chemical form. Now, there's also a little bit of confusion about kind of the different omegas, right? We hear the word omega and we know, all right, we want more omega-3s. We talked a little bit in previous webinars about omega-6s, but Omega-3s, oftentimes, sometimes you'll see like omega-369 products or omega-3/6 products. Oh, this has a specific ratio. Again, if we're talking about raising omega-3 index levels, we really want to focus on omega-3 only products. And these can be combinations of EPA and DHA. They can be EPA only, DHA only, and you can have ALA products, so that alpha linoleic acid. Alpha linoleic acid has benefits, but it is, but it is not included in the omega-3 index. It's not one of the two omega-3s that impacts that. EPA and DHA are the only ones. So really, for our purposes, we're going to be talking about these EPA and DHA combo pills or EPA only and DHA only. As far as omega-6, omega-9, or these combination products, for the most part, we want to stay away from those when we're talking about improving our omega-3 index levels. Omega-6 levels, there's a lot of controversy around consuming those. Most of us are getting plenty in our diet. There's, again, a little bit of controversy on whether or not we want to decrease those in our diet, remain the same, if we should be concerned about them at all. There's a lot to talk about, but for the purposes of this, when we're talking about improving our omega-3 index levels, we really want to focus only on those omega-3s. So the EPA-DHA combo, EPA and DHA only. So most omega-3 supplements that you're going to find are going to be a combination of EPA and DHA. So if you pull out a fish oil, or kind of really any omega-3 supplement, most of them are going to have EPA and DHA in them. And we don't have a specific ratio that we recommend for the EPA and DHA. We get this question a lot, like, how much do I want a 2-to-1 EPA to DHA, 1-to-1? It's not quite clear exactly if that matters. And it probably matters more depending on what area of the body you're focusing on. And if you're talking more about, let's say, brain injury in sport, if we're looking at, the prevention of concussion injury, then you might want something that's a bit higher in DHA or possibly a DHA only supplement. For most people in most use cases across most conditions and for prevention that we see kind of across the board, for most people, they want a good amount of EPA and a good amount of DHA. If you can find one that is roughly equal, then that's pretty good. You don't necessarily need a 2-to-1 or an exact 1-to-1. Again, I showed that first product that had, I think it was 600 DHA and 800 EPA. That's pretty close to 1-to-1. That's pretty close. And that's ideally for most people, that's what you would be getting. It's kind of close. Most supplements, if they're going to be heavy in anything, are going to be heavier in EPA and have lesser amounts of DHA. So we don't necessarily want supplements that are just EPA for most people. We want to try to get both. However, in the single fatty acid category, there are use cases for both of those as individuals. So for DHA only, like I mentioned, if we're talking about athletes or military members that are trying to reduce risk of brain injury, we may want a really high DHA supplement. For EPA, again, if you're looking specifically for treating somebody with hypertriglyceridemia, you might want something that's a bit higher in EPA. But in both of those cases, there's no downside to having a little bit of EPA when you need a lot of DHA, and same thing with the hypertriglyceridemia. There's no harm in having some DHA along with that EPA. And then, as I mentioned, ALA has health benefits, but it doesn't impact those omega-3 index levels. So I'm not really going to go over that as much here. So kind of just sum this part up. For most people across the board, you really want to try to find a supplement, if you can, that has roughly equal amounts of EPA and DHA. If it's not exactly equal, it's not a big deal. There's no need to kind of overthink that. If it's 1,000 and 500, that's a 2, it's fine. That's okay. But any more than that 2-to-1, I probably might be looking for something that's a bit more balanced. But again, if you have a product that is a little bit unbalanced, you can finish it out and find something new. It's not going to be harmful by any stretch. All right, so omega-3 sources, this is kind of where the omega-3s are sourced from. And these are kind of the biggest buckets of popular, kind of the most common omega-3 supplements that you're going to find. The first category here is fish oil. And a lot of the times, and I've done it during this presentation already, which is interchanged omega-3 and fish oil, kind of use them as interchangeable terms. Obviously, omega-3 supplements can come from krill oil, algal oil, cod liver oil, flaxseed oil, but they're not all fish oil, but all fish oil most likely has omega-3s. I shouldn't say all, but most. But they're not really interchangeable terms, but oftentimes they get interchanged. So fish oil, most fish oil is sourced from sardines, anchovies, herring, or menhaden fish. And again, most fish oil products are going to have EPA and DHA in them. Krill oil, krill are these small shrimp-like marine animals. They get eaten by like whales and larger marine life, and that's the source of krill oil. They also have high amounts of EPA and DHA. Typically, we'll find both in krill oil. Algal oil, this is marine algae, so that's what you think of when you think of marine algae. And this is the only plant-based EPA and DHA source. So if you are a practitioner and you work with a lot of plant-based individuals, or you are someone who eats a plant-based diet and you're looking for a vegan source of EPA and DHA, algal oil is kind of going to be your go-to. It's really kind of the only one that you are going to be able to find that is plant-based to get both EPA and DHA. I'll skip down to flaxseed oil real quick. Unfortunately, a lot of people will say, oh, I'm a vegan or vegetarian, I'm going to get flaxseed oil instead of fish or krill. And unfortunately, that does not have EPA and DHA. It's heavily in ALA, which again, it does not improve those omega-3 index levels. So there's nothing wrong with taking flaxseed oil or eating flaxseed. It's perfectly fine for you. It just doesn't achieve the goal of increasing omega-3 index levels. Cod liver oil, to go back up one level, this is another really popular supplement. This comes from exactly what it sounds like, the liver of codfish. And that is really high in EPA and DHA. Generally speaking, there are some differences between fish oil, krill oil, algal oil, cod liver oil in terms of some of the form of EPA and DHA. For instance, krill oil actually has a pretty high amount of phospholipid form of their omega-3s. But for most individuals, the differences between those four categories are very minor and don't matter too much. So obviously, if you have an allergy, that would make a big difference, right? If you can't have fish, then you may need to have the algal oil because that's going to be your source if you're not allergic to that. That's going to be the big difference. If you're a vegan, you're going to want to go for the algal oil. But in terms of practical differences between the four, you really can pick and choose what you like. The big things that matter are dose and getting enough of your supplement. Okay. So if you're trying to decide between a krill oil and a fish oil, I don't want to say it doesn't matter at all, but for the most part, as long as you're getting a high enough dose of the omega-3s that we care about, those EPA and DHA, it really doesn't make a huge difference if you get it from a fish oil or you get it from a krill oil. Then it becomes kind of a personal preference. If you have an item you like, it's not a big difference. So dose is by far the most important factor in fish oil selection. Like I said, of those four categories, you can kind of interchange them. They both have EPA and DHA. There are small differences, but dose is the biggest thing. Omega-3 index levels increase in a direct dose response, i.e. the more you take, the higher levels will be. So people who take a lot of omega-3s are going to have much higher omega-3 levels than those who take very little or don't take any. Supplements and food sources count towards your total dose, but for many individuals, especially here in the States, supplements make up a lot of their intakes. We are just not a society to eat a lot of fatty fish. I wish we were, but it can be really difficult. And so supplements tend to make up a lot of people's intakes of omega-3s. So dose is the most important thing. If your index isn't going up, a lot of the times it's because you're not taking enough. So this is just some research showing that dose needed to get to 8%, and showing that the baseline omega-3 index dosages, you need a lot more. So if your baseline omega-3 index is 4%, in order to get to 8%, you're probably going to need somewhere around that 2.2 grams per day of triglyceride or of an ethyl ester form. And I'll go over those forms differently in a minute. But just showing that the higher your baseline is, the less you need daily, because you're probably already getting enough through your diet. But yes, it's dose response. It's like directly dose response. The more you have, the more you take, the higher your index levels will be. So how do you know what dose you need? Well, as that graph kind of suggested, you need to find out what your baseline is. So the first thing to do is to test your omega-3 index levels. If you're not sure, you need to get a test and find out what your baseline levels. So say you do your test and you get it back and your omega-3 index level is 5%. How do I know how much I need to take? It's very different for everybody. We have a calculator on our website. If you go to omegaquant.com and go into resources, we have this omega-3 index calculator where you can enter in your omega-3 index level, and it will give you a dose amount of EPA. It'll do it right on the bottom, EPA and DHA that needed to reach your target level. So for someone whose level is about 5, you're probably going to be somewhere around that 1,500 to 2,000 milligrams, depending on a lot of things. Now, there is some caveat to this, in that there are many, many, many individual factors that affect how somebody or someone's needs for a supplement or someone's needs for omega-3s. So for instance, age. Older adults are typically going to need a little bit more omega-3s than someone who's younger. They have a higher inflammatory burden, and so their body is going to chew up their omega-3 stores a lot faster than someone who is younger. Health status, the same thing. If you have inflammatory conditions or you're taking medications that induce inflammation, let's say like not steroids, but if you have a condition where you may be on steroids, those can increase your need for omega-3s. You're chewing through your omega-3 stores a lot faster than someone who doesn't have like an inflammatory condition. High amounts of activity. So I wish I would have just put stress here, both physical stress, emotional stress, psychological stress, all of that stuff, but high amounts of activity, especially if you're training for a marathon, if you're in the military and have a really physically tough job, if you just are extremely physically active generally, if you have a physically tough job that's not military, you probably have higher amounts of oxidative stress. So you're going to need higher amounts of omega-3s than someone who maybe doesn't have that level of physical activity. Your current omega-3 index status. So this should be the top level one, but what your levels currently are. If you're someone who eats fish a couple times a week, fatty fish, and your omega-3 index level is 8 naturally, and you've done that forever and ever, then you're not going to maybe need a supplement or need a very small amount of a supplement to kind of push up a little bit. And then your weight. Heavier individuals, generally speaking, tend to need a little bit more. And again, I can't say exactly per pound how many more milligrams you need. Again, this is why testing becomes so important, is because all of these factors relate into your individual needs. And I can't exactly say everyone's individual needs without seeing testing. So testing, starting a regimen, retesting again, and adjusting the regimen is kind of how it goes. It is a little bit of a trial and error game, but the testing kind of focuses in the efforts instead of just blindly hoping you're getting enough. All right, so next we're going to talk about form. This is kind of the interesting topic a lot of people want to talk about, is the different types of forms of omega-3s out there. I'm going to cover the 3 that are kind of the most popular. There are some newer ones that have come out a little bit. The most recent one I heard about was a monoglyceride form of omega-3s. I'm not going to talk about those because there isn't a whole lot of research that has been done in those forms and how they relate to uptake and comparison on tests. The research just isn't there. So I'm going to talk about the three most common form, which are ethyl ester, triglyceride, and phospholipid form. Ethyl esters are created. These are manufactured fatty acids, and they are, it's basically fatty acids are removed from the glycerol backbone naturally. So naturally occurring omega-3s are in triglyceride form. That triglyceride structure in that A one right there, it's the glycerol backbone and three fatty acids. Three fatty acids. That's your triglyceride. What happens in ethyl ester form is those are removed and then reattached, and it makes the process of extracting omega-3s a little bit easier because those bonds can be broken and then reformed, and they are reattached through a process called reesterification. And these are a little bit easier to produce rather than extracting the pure form of triglycerides. It's a little bit more chemically complicated than that, but for kind of simplicity's sake, that's really what ethyl esters are. Triglycerides, this is the form that is found in food. So if you are eating your omega-3s, if you're consuming them from fish or algae, this is what the natural form of fish oil is. It's difficult to extract fish oil or omega-3s in that pure form, but they tend to be absorbed better in this triglyceride form. And then phospholipid, this is it's a little confusing. So phospholipid form can also be found in nature as well too. And phospholipids are the way that omega-3s are absorbed into brain tissue. However, so a lot of people think that okay, because if it's phospholipid in the product, then, and it's phospholipid that goes into my brain, then that's good. Then that is better. I want more of that phospholipid form. However, upon absorption into the digestive system, all of those phosphate groups are cleaved from the phospholipid, from the fatty acids, and then reattached at a later point for absorption into the brain. So it doesn't matter that you're getting it in phospholipid form. There is some evidence that there might be a slight better GI uptake of phospholipid form, but the research is really, really new on that. What we do know is that since the triglyceride form is what's found in food, that is really well absorbed. So the phospholipid form, again, I'm not going to talk too much more about that. And the reason is because the bulk of the research has been kind of comparing ethyl ester and triglycerides. Some new research is emerging that phospholipids may have an itsy-bitsy, teeny tiny advantage when it comes to GI uptake versus a triglyceride form. But again, that phosphate gets cleaved and then reattached when in another stage of absorption before entrance into the brain tissue. So it's not like that whole phosphate group and the whole phospholipid structure makes it to the brain. So that kind of assumption that, more of that would be better is not necessarily the case. So when we're comparing triglycerides and ethyl esters, those are the two most common forms of fish oil that you're going to find on the market. Over time, triglycerides perform slightly but significantly better than ethyl esters. So in this particular graph, the bottom is the control. The triglycerides are that top line, and then the middle line there is ethyl ester. It's a slight difference, but it is significant over time. And the big thing that we notice is that it's also a very individual difference. Some people are affected more by having a triglyceride form versus an ethyl ester than others. Some people tolerate the ethyl esters just fine, and it raises their levels, and it's effective for them. Others do much better with a triglyceride form. So in this particular instance, normal responses to supplementation. This individual, James, was on their increasing triglyceride dose and continued on that dose and saw their levels increase. Adam, same thing, saw regular increase on his ethyl ester dose. This is what we would expect. Anybody taking supplements would see their levels go up, right? However, some people, like Nate here, for instance, these are from our internal data as well. he didn't do so well on the ethyl ester, but when switched to 2150 of the triglyceride, he had a massive jump in his omega-3 index. And that is kind of shows that to some people more than others, form is more important. If you're taking an ethyl ester supplement and you've gotten up to that 12% and you're doing fine, no reason to change. No real reason to change. If you are taking an ethyl ester supplement, you're not seeing improvement, then you may want to consider a change. So the next here is delivery mechanism, and this really comes down to personal preference, to be honest. So this is liquids versus capsules versus gummies versus ready to drink beverages. I almost didn't include this on here because it's the doses in those are very, very low. But the two big ones are liquids and capsules. Liquids tend to be the highest concentrated and oftentimes are the most cost effective. They're pretty expensive individually, but for the dose that you're getting per teaspoon, can be the most cost effective per dose, and you're getting the most omega-3s. But a lot of people have a little bit of a hard time swallowing liquid fish oil. So if that's not your preferred route, that's totally fine. Capsules are perfectly fine. It's the most easy to find. You're going to find fish oil capsules or omega-3 capsules kind of everywhere. It's the most common form. It's very easy to adjust the dose. So as I used in those earlier examples, if you need to just take one more to achieve your total desired omega dose, you can. It's a little harder to convert that when it comes to liquids and teaspoons and stuff like that, keeping track of how many quarter teaspoons you're adjusting. It's a little harder, more math involved. And the downside with capsules is depending on the product, you maybe end up taking a lot of pills. And for some people, they just don't like that. And so they tend to prefer the liquids. Gummies, everybody likes a gummy. However, they tend to be really, really low doses if they have omega-3s in them at all. We're talking 1, 2, 3, 400 milligrams at the most. So the doses tend to be really, really low. And for the most part, I don't recommend gummies to almost anybody. And the same with the ready-to-drink beverages. I've seen these in a few different products. It's fine if you're taking like a protein shake that has some omega-3s in it. That's fine. You can include that in your total daily dose. But I would not look for one of those as kind of your primary source of omega-3s. They taste good, but you're not going to get a ton of omega-3s out of them. Okay, try to hurry up here a little bit. Food. So taking fish oil with a meal containing fat increases absorption significantly. So time of day isn't super important when you're some research, depending on the outcome, that suggests nighttime is like ever so slightly better. But the most important thing is taking it with some food. If you're taking your fish oil or your omega-3 supplement without any food, or you're taking it on an empty stomach first thing in the morning, either change the time of your supplement so it lines up with a meal or start eating something. Put avocado toast here because it's got a lot of fat. The egg, bacon, it doesn't have to be that, that much fat, but, and the type of fat doesn't matter. You don't have to eat it with salmon. You can eat it with any kind of fat, but fat helps fat absorb. And so it is important to make sure that you are taking your supplement with a meal. You can take it at breakfast, lunch, dinner, snack, doesn't matter, but as long as it's a meal that contains fat. Food can make all the difference. So again, this is just some internal data of examples of individuals who, in her case, Lila here, was taking an ethyl ester supplement. We switched to a lower dose of triglycerides, but then also had her start eating her taking her supplement with food, and she saw much greater success than she was before, because now she was taking a lower dose. She doesn't have to take as much. She switched her form and started eating it with food. The last part here is consistency. Consistency is really, really important. A lot of people think that I'll take a certain dose, I'll get up to 8% or 10% or 12% on omega-3 index, and then I'll just lower my dose or stop taking it, or I can be inconsistent and I'm already where I need to be. Wrong. It's a fat. We need to continue taking it throughout our lifetime. Once you reach 8%, you need to keep doing what you did to get there. It's not a situation where you can get to a level and then decrease your dose and maintain. The only case where that would be the case is if someone overshot the mark and got themselves up into the teens, 13, 14, 15%. That's not necessarily dangerous in any way that we know of, but maybe they are just taking too much supplement and they want to save themselves some money. So continue taking a consistent dose, and continue taking your dose to keep your levels. All right. All right, a few more notes before wrap up and answer some questions for fish oil supplements. Number one is storage. As with all fats, you need to store them in a cool, dark, dry place. Don't put your fish oil on the counter or on the windowsill in front of a window. If you can put it in a medicine cabinet, even be careful with a medicine cabinet, especially if it's in like a dark or a small bathroom, because humidity and temperature changes can really make cause oils to go rancid, and exposure to too much light can as well too. So dark, cool place with not too much temperature fluctuation. Rancidity. Quality fish oil should not smell bad or fishy. This is a question we get a lot of, oh, I don't like fish oil because it smells really bad. But the problem is a good quality pure fish oil should not smell nasty. It shouldn't smell really, really fishy. It should sort of have a neutral smell to it. And if you're noticing that your product has like a really stinky smell and you're going to take it and you're like, oh, this is smelly, throw it out. It probably has gone bad. As with any fat, so think about leaving, olive oil or butter, any kind of fat. If it can go bad, and it will smell quite bad. So that's one to just keep out for. Beware of where you order. And oftentimes, especially with fish oil products, it can be best to order directly from the manufacturer. The reason I say that, or directly from the company that is producing it. And the reason I say that is because oftentimes, especially if you're ordering from kind of a big online distributor place, those products can end up sitting in warehouses for a really long time and either go bad, so look at expiration dates, or just go rancid because they've been in a hot warehouse for a long time. So just be careful of that. Look at your expiration dates. That's with any medication or supplement, but just make sure you look at your expiration date. If your omega-3 index is not improving as expected, it might be your supplement, and there's many reasons why. So testing is really crucial. Again, we want to get a baseline test, dose and adjust products, include food, consistency with taking it, and then retest and repeat if needed. We want to get you to where you want to be and then maintain that regimen going forward. All right. So I'm going to go ahead and pause there and go ahead to the questions. Apologies for rushing the last few minutes. I could talk on this subject for hours and hours and hours, so I'll stop and take some questions.
Awesome. Thank you, Kelly. Awesome job. Great information. All right. First question coming through. Does conversion from omega-3 ethyl esters to omega-3 triglycerides in the liver create alcohol? And is it more detrimental on keto diet? It's an interesting question. I'm not sure.
I don't know the answer to that question. Do you know the answer to that question, Tavis?
I don't. I don't even know if that's even been studied. So I think that would have to be studied. Yeah, you'd have to take, a lot of individuals on keto diets, supplement them, but I don't even know if that's even been effectively done. But that's a good question. Yeah. It's interesting.
It's a great question. Don't know.
This question, I think, might be associated with our testing of omega-3 index, since we don't test fish oil. Which methodology does Omega Quant use to test omegas?
It's the omega-3 index. I'm not sure which method they're kind of referring to. If they could,
maybe liquid chrome or mass spec. Yeah, and it's I think and I guess if you're asking that question, are you asking how we test blood? Because we only test blood. We don't actually test supplements. So we're only testing someone's blood.
Yeah, we only do the blood test.
This question is about histamine sensitivity. What form, ethyl ester, triglyceride, or phospholipid, is better in case of a histamine sensitivity?
These are really good questions. I don't know the answer to that one. If we're talking about a histamine sensitivity, I'm not sure. Do you know the answer there?
I think that would have to be based on the individual. I know there are certain types of food sensitivity tests like MRT LEAP and other food sensitivity tests, allergy tests. I think that's really individual dependent. I don't think everyone would fall into the same category.
Yeah. And obviously if you're, again, I'm not sure on that one. I'm kind of with you, Tavis. I think it's very individual. And obviously if you have an allergy to fish, you're going to have to go through, it's going to be a little bit more difficult. Those algal options are going to be for you. But the histamine sensitivity, that's an allergy. So not sure.
This is a good question. How do you know if your supplement is in ethyl ester or triglyceride form?
Okay, yeah, that's a really, really good question because it's not always obvious. The first thing I would do is look at the bottle and see if it says anywhere on the bottle. A lot of the times they don't specify. You can go to the manufacturer's website and look at the actual product page and see if it's mentioned there at all. Products, generally speaking, this is not a rule of thumb across the board, but it's kind of just a generally speaking, if with triglyceride products, usually the manufacturers, the companies that are selling them are usually pretty proud of that fact. So they usually will have it on the product page somewhere. If not, you may have to get in contact with the company that is manufacturing it in order to find that out. It's not always easy to know, and that's kind of in among the many difficult areas of finding a product. That's one, is it's not always easy to know.
The only thing I want to add there, not all triglyceride means the same thing, because you can
Correct.
actually get your oil manufactured 50% triglyceride, 50% ethyl ester. So you really
Yep.
want to look on the back of that label or ask your company. So if you have a product that is triglyceride, ask them, is it greater than 90% triglyceride form? Because if it is, that's the highest you can get in the oil for manufacturing purposes and for bioavailability. So be sure to ask whoever manufactures or the supplement brand you use, what percent triglyceride form if they don't indicate that on the label.
100%. Yep.
From what age can the omega index test be done?
So our test is we only recommend it for adults, but it can be done for children. I don't know a specific age that it can be done at. The current research suggests that for kids, I believe it starts at age 4 or 5. Their goal omega-3 index would be 6% as opposed to the 8% for adults. So you can give an omega-3 index test to children, but we set all of our norms and goals for adults and recommend it only for adults.
Is it preferred to store in the refrigerator, your fish oil?
You don't have to. So a lot of people do think you have to. That's a very common practice, is storing your omega-3s in the refrigerator. You can. There's certainly no reason. A lot of people used to do it in the freezer as well too. It doesn't matter. Either one is fine. The fridge is a dark and cool place. So if you want to, you absolutely can, but you don't need to. You can store it in a cabinet, just wherever that's away from direct sunlight or direct light, and not somewhere that's going to get hot. But you absolutely can store it in the refrigerator. Yep.
This is more specific to usage. Recommended dose for DHA for concussion in sport.
Well, okay. Well, it depends. It depends on if we're talking prevention or if we're talking treatment. So that's a really big question. This is more of a usage question, but I'll answer it just because I happen to know. So on the prevention side, we want to try to have someone have an omega-3 index of 8 or higher. That is the biggest thing. If you have someone, either a patient or a child, or you or yourself are an athlete, you want to try to have your omega-3 index be 8 or higher. And that has shown to be somewhat protective against some of the possible negative side effects of head injury. Post head injury, there's a lot of different schools of thought on this, but again, having that omega-3 index of 8 or higher, if you have someone who does not have an omega-3 index of 8 or higher, you can do high loading doses. And again, that very much depends. They're usually stepwise dosed from something very high, like 8,000 or 9,000 milligrams a day over the course of several weeks, down to a more reasonable, like 2,000 milligrams a day. But the big thing is, if you or somebody you work with or your children or whatever are playing contact sports, trying to get them to have an omega-3 index of 8 or higher is the goal before head injury.
How often would you recommend someone retest their omega-3 levels?
Not any more often than 3 or 4 months. If you are currently trying to adjust your regimen, doing it every 3 or 4 months until you get to where you want to be, and then doing it 1 to 2 times a year is adequate. If you're already pretty good, you've been taking your regimen for a while, your omega-3 index looks great, You could do it once a year for kind of your information if you want to. If you have, an illness that happens or something like that and you want to reevaluate, then you may want to do it slightly more often than that. But I would say every 6 months to a year, unless you're kind of in the middle of like working out what your regimen might be. And then no more often than every 3 to 4 months.
So Nadia came back and asked what method that we use for testing the blood for omega. It is gas chromatography with flame ionization detection. Where does wild salmon and pollock oil fit as a source?
Yeah, so there are so many different options. Like I said, I couldn't touch on all of them in the time that we had. Both of those are good omega-3s, and what you really want to do is follow the same set of guidelines. The source is almost less important than looking at that label, turning around and seeing what the actual omega-3 dose is. So wild salmon and pollock oil are perfectly fine. Just make sure whatever product you're looking at, turn over the bottle and look for those EPA and DHA doses. That's really the most important thing. They both have omega-3s, and they would fall in that fish oil category, just not they weren't on the sources that I listed, but yeah.
Some really great questions coming up. What should be the dose difference between a woman that weighs 50% compared to her husband?
I can't answer that individually, and this is why testing is super important, because you could have a situation where if a woman is 50% weighs 50% less than her husband, but has chronic disease, right, or is training for an Ironman, and hubby is sitting on the couch. It's so very different. It's so very individual. So I would recommend in that case is that you both get tested. See what your levels are at, base your dosage off of those levels, go to the calculator, try that out, wait 3 to 4 months, retest, and then tweak from there. Because there's so many factors. Again, I can't just say like off the top of my head. It may be a wildly different dose. It may be slightly different. It's really hard to say. A weight difference that large is going to make a difference. But again, there's so many other factors that it's impossible to say exactly.
A little bit longer question, but an excellent question that I'll read slow. How should dosing be administered to pregnant or lactating women and children? I've heard that EPA is not good for pregnant women and children under 3 years of age, and that it competes with arachidonic acid. What are your thoughts?
So, it is not that EPA is bad for pregnant women. It is that DHA is so important for pregnant and lactating women. Oftentimes, like I said, a lot of supplements are very EPA heavy, and it is not that EPA is bad. So I want to get that out of there. Is not that EPA is bad. It is that DHA is often so lacking, and it is so incredibly important for brain development, eye development, cognitive development, in fetus in utero, and for the first 2 years of life. So that's why the dosing is super, super important. We also have a test that is a prenatal DHA test. So this looks exactly at DHA levels, specifically at DHA levels for pregnant women. And then we also have a mother's milk test that looks at DHA levels in mother's milk. I believe the prenatal DHA goal is 5%. And the reason we encourage DHA is because of the crucial role of DHA in brain development. The brain it's a huge percent of brain structure is DHA, is based from DHA, built from DHA. And because we tend to get so little of it, and because we've had a lot of bad nutrition information, kind of misinformation go out over the last 30 years about telling women not to eat fish, DHA levels tend to be very, very low. Intakes tend to be very low in pregnant women. So it's not that EPA is bad. It's that we need DHA so badly. We need it so much. So I can't tell you the exact dose of DHA that every pregnant woman should get. I believe the minimum recommendation is somewhere around, I think it's like 400 milligrams, 300, something like 600. It's pretty low. The recommendation that I think it's like the WHO puts out, it's not enough to get women to that 5%. And again, that's going to be very individual. Does she eat fish at all? Does she take any other supplement that has DHA in it? So I would recommend, again, testing in that case. I forget the original question is, why is EPA bad? EPA is not bad. it's that DHA is so desperately needed that that's what we super focus on in pregnancy and lactation.
So this question, can we also increase our omega-3 by only using DHA or only EPA? Is one better than the other?
You can, yeah, it's going to go up because if you're just taking DHA, that omega-3 index is both EPA and DHA. So if you increase one of those, it's going to go up. Most people have a harder time getting DHA in their diet. So either or, like, you can take one or the other. Like I mentioned, there's many use cases where you would want one or the other, one preferentially over the other. And so, there absolutely you could. As far as dosing goes, if you need 1500 if that could, let's say the calculator and we've kind of figured out you need 1500 milligrams of omega-3s to get your index to 8%, then you would need, if you're just going to take DHA, you need 1500 milligrams of DHA. Does that make sense? You need a total dose, doesn't matter the split, of that 1500 milligrams. And it's kind of on your choice if you want to do what the combo is. And again, the use cases are, it's like we're talking about with brain injury or pregnancy, anything brain related, we're going to really think about DHA because it's so important for brain function. But EPA has many other functions as well too, like I said, cardiovascular, hypertriglyceridemia. So there may be cases for that as well too. So the total dose of omega-3s is that regardless of what the mix is. So if you're going to take one or the other, you still need that total dose.
This is a really good question, and I have an experiment, not personally, but that we talked to a customer about what they did with this. But what are the reasons that some people don't react well to omega-3 supplementation, and what are some potential ways to mitigate that so they can benefit from omega-3 supplementation?
Oh man, yeah. So there's many different reasons, many. But big ones that off the top of my head, obviously allergy. If you're a person that has any allergy to a fish product, you're going to have a harder time with tolerance. Next is GI. That's usually the things that we see most of people complaining about GI, and that can kind of come from two different routes. It either can come from a poor quality product. So oftentimes, if you've got a product that has gone bad or a product that is not a more pure product, so it's got other like filler oils in it, things like that, you can see, not to be gross, but you can see people call it like the fish burps, or they get a lot of indigestion from taking their fish oil. It may be just a bad product. As far as if you're taking a pretty good product, but you're just having a little bit of a hard time GI wise, like maybe it makes you feel really full. I've heard that complaint before that people would their dose. Especially let's say you're taking 4 capsules of something and it's just making you feel really full, or maybe you're getting heartburn. That's another one you can get from it because you're taking a lot of fat at one time. If you already have reflux, heartburn, you can fat can really make that worse. So the big things are making sure you're taking it with food. That almost always improves tolerance of a fish oil product. You can also split up your dose. So if you are, let's say your dose is 4 capsules of whatever product you're taking, you can take 2 in the morning, 2 in the evening. You can take 1 at each meal and 1 before you go to bed if that helps you. It doesn't matter as long as you're taking it. I like to think of it like, if I was getting this through food, how would I take it? I wouldn't just make sure I take all my salmon at one meal, right? I could spread it out if I wanted to. I could have tuna at lunch and salmon at dinner. Same thing with your fish oil supplement. You can take it throughout the day. That will often help, taking it with food. And as with anyone with reflux, if that's an issue you experience, don't take it before you lay down. So if you're taking it immediately before bed and then you're laying down, gravity will not be your friend. So maybe you want to be a person that takes it a few hours before bed, like when you're eating dinner, or take it at lunchtime or something like that. So where you're not going to be immediately laying down. Tavis, is there anything you'd like to add to that?
Yeah, we talked to a brand, a supplement brand, that they were using their product with someone, an influencer, but they were using 3,500 milligrams of combined EPA and DHA a day, which is a great dose. I mean, that's a big dose, right? And
yeah,
in 3 months, they only went from 3.8 to 5.3%. But then we realized that individual had Crohn's disease, which was blocking their ability to absorb. It's a whole different conversation.
There's a whole anything from, I mean, really the GI tract is It's pretty long and there can be a lot of complications. And because it's a fat, really any nutrient absorption can be affected. So if you have any sort of GI issue, you can be at risk for not tolerating or having issues with a supplement for sure.
So some new brands are claiming they use fish oil from wild caught instead of farm raised. Does that even matter at all? Do we know?
I mean, at the end of the day, the dose is the most important thing. So it doesn't really matter. It probably matters more when you're eating fish, simply because a wild caught piece of salmon may have more DHA in it than, more omega-3 in it than a farm raised, though I'm not 100% sure of that. But as far as the supplement goes, it doesn't really matter. What matters most is the dose you're getting. So like as long as the dose is what it doesn't really matter. The dose is king in that arena.
Will Parasol offer algal DHA EPA? I'm sorry, algal DHA and EPA. And I can answer this one. I mean, we have discussed this, and we are about to produce another run of our triglyceride form product. It's certified for sport, which I think is important because we do a lot of product use in the college and professional sports space. We don't know. I can tell you one thing: the fishery industry has had two very awful years of catching fish. And I was just at Expo West, and a lot of the discussion is we're seeing fish oil prices are going to be skyrocketing if they haven't already. So those supplement brands, if they haven't secured crude oil in large quantities, you're going to expect to see significant increases from fish oil. Actually, in many cases, algal may be less expensive very soon than fish oil. So that's something that we've discussed internally. We're not sure. It takes a lot of investment to offer a new SKU, but we're working on some things internally, potentially in the future, to have some different variations with omega-3 for different purposes. But we're just in the beginning discussions of that. So as those things happen, we'll keep you posted. Does fish oil Totox value influence the index? Are you aware of that at all?
Does fish oil?
I don't know if it's tox value or Totox value.
I don't know. I'm
think that's part of the manufacturing process for heavy metals and different things. But I'm not. I don't think. I don't believe it does. I think what's going to mostly do that is going to be the amount of oil in the form.
Correct.
Should we look for the molecularly distilled and filtered fish oils?
I mean, it's a little bit of a. Do you want to answer that?
A little bit of a higher quality, definitely. But most importantly, I think two things that are critical is what form it's going to be manufactured in, and is that manufacturer that manufactures those oils, are they a certified GMP facility, or is the manufacturing facility certified by NSF or Informed Sport? Because both of those certification agencies have facility certifications that go in, swab those facilities, or at least Informed Sport swabs, and make sure that they're not using heavy metals and toxic. But yes, that does help the purity a little bit, but not significant. Is ocean pollution a problem in the fish oil supplements? Not sure. That's where I think someone in the industry would probably know that a little bit better. Does DPA count in omega-3 totals?
No. Well, yes, it can in a supplement total. If it says total omega-3, DPA can be listed on there. But in terms of what we care about for raising our omega-3 index levels, DPA doesn't count. So I should say it can, but just remember, you want to look for that EPA and DHA dose on the label and add those two together. It's not bad to get DPA, but that's not part of the related to the omega-3 index.
Just a few more questions and we're going to close it out. What is a baseline amount of EPA DHA combo that we should be looking for in a supplement?
So if you're talking about a minimum, like with value, I would say so dependent on what you're getting. So if you, again, try to get if you can find equal-ish amounts, roughly equal amounts of EPA and DHA, and then for my money, any supplement that is going to have less than 1,000 combination milligrams of omega-3s, meaning a combo of EPA and DHA together, is probably going to be difficult to get more, to get enough of the dose that I need. I'm going to end up having to take more of it. multiple pills or multiple serving sizes in order to get what I need, and I'm going to end up having to buy it more frequently. So for is kind of a general recommendation, if your product that you have, or if you're looking at products that have less than that 1,000 milligrams EPA and DHA combined, I might consider something else, just simply because most likely most people, again, this is very generalization because everyone's different. Most people are going to need at least 1,000 to 1,500 milligrams a day, if not more, in order to get to their omega-3 index of, excuse me, of 8%. So again, if I need 2,000 milligrams a day and I've got a product that has 750 combo EPA and DHA, I'm going to have to do the math so I'm going to take 3 servings. I'm probably going through my product 3 times as fast as I'm supposed to. I'm just going to be rebuying. So that's a general guide. If you see something that has less than that, I probably would move on to something else.
Last question. I've had 2 friends insist all manufactured fish oils are toxic and bad by the time you get them. What can I say to them?
Wait, can you say that again? Can you repeat that?
She's saying, I've had 2 friends insist all manufactured fish oils are toxic, bad by the time you get them. What can I say to my friends? Yeah.
Okay. Well, toxic, I'm not sure what they mean by toxic. So toxicity is not the same thing as like rancidity, right? Toxic, I think that's not, no, I mean, most of these are manufactured in a way that toxins are pretty well filtered out. So toxic is not what we're talking about. Rancidity, yeah, that can happen sometimes, especially depending on where you're ordering it from. That's why I don't want to say any bad places to order things from. I want to be careful here, but if you're ordering from, let's say, a very large online place where people shop and have memberships to, oftentimes you can have products sitting on pallets in warehouses for a really, really long time because of the way that they're purchased and the way that they're shipped to those places. So it's not always the case with every product. It depends on the way that it's sourced, but that can happen. That's why check your expiration dates and smell your fish oil. If you smell it and it smells like fine, if you're not offended when the bottle, when you take a big whiff into the bottle, then it's probably okay. I know that sounds very rudimentary, but it's just like milk, when you go to smell milk and it's the same thing. It's a fat, it goes bad. I would not say most fish oil is rancid. I would say there's probably a good amount out there that is. I would also caution people on stocking up too much on their fish oil. This is another one where people will buy a lot. They'll buy like a year's supply all at one time. Your fish oil may expire in that time, or it just may go bad. So being extra careful of that. So I will say to respond to your friend, I would say some of it probably goes rancid, but if you smell it and it doesn't smell very fishy or offensive smelling, then it's probably okay.
Awesome. Kelly, thank you so much. This was fantastic. Thanks to everyone who registered. Thanks for those that were here
thank you.
In the live room. We will get you in the next week a copy of the replay so you can have that. If you're a dietitian, we'll have your certificate as well that I will be sending out once all of that is provided. Also, just a reminder, April the 16th, at 12 o'clock Central Time, Dr. Bill Harris, our founder and inventor of the Omega-3 Index test, will be updating us on all the new research around Omega-3 testing and what his lab at FARI, which is the Fatty Acid Research Institute, has been publishing. So you will probably hear from me. I will send you that link. Once that link has been provided to me, when I send out the replay, you will get access to that. As always, we appreciate your time. We appreciate you spending an hour and a half almost today with us to learn a little bit more. We'll continue to update. All I will say too is be on the lookout. Something really cool we're developing for early next year is coming. It's going to be all related to Omega-3 education for practitioners and individuals who want to learn about different topics, but we're planning a pretty big event. I'm not going to give you any specifics just yet. Once it's confirmed and once we have what we're trying to build, then we're going to let you know about that in the next couple of months. So be on the lookout. Thank you all so much. Y'all have a great rest of your Tuesday and rest of your week. Take care.
Thanks, everybody.